I want to thank you for visiting our website. Welcome. The whole purpose of this recording is to give you some idea as to what our philosophy is here on health and healing and how we help people who are suffering, people who aren't feeling so well, or people who are having their quality of life diminished. It could be something as simple as neck pain or back pain, or it could be something much more severe. Chronic fatigue or Lyme disease or autoimmunity, diabetes, a whole host of different items. Whatever it is that you might be suffering with, you may even have symptoms that no one's been able to explain. You may be suffering with things that your doctor says, your blood work is fine, there's nothing wrong with you, it's all in your head, take this antidepressant. We deal and help people like that all the time as well. My purpose and my mission is to help people who are suffering, people who they may think that there's a way to be helped, and we're here to help those people, but also those people who are up late at night praying that someone would be able to help them. That's our mission and our purpose and our passion, and that's my goal, to help you. So let me tell you about my story. My story begins as a chiropractor in 1998. That's when I graduated chiropractic school. Sometime after that, I was diagnosed with an autoimmune condition, a very serious autoimmune disease. And back then I was told that I would have it for the rest of my life, and there was nothing that I can do to fix it except for take medication for the rest of my life, and then maybe even have surgery to remove a certain organ. So that was really hard for me to take, and it was very difficult for me to take. I was also told that there's no diet that could change things, it has nothing to do with diet. I was told that there's nothing to do with heavy metals or mercury, and at the time I had a mercury amalgam fillings. I was also told that there's no parasitic infection, no viral infection, no bacterial infection, that there was nothing wrong with me. I was told that my immune system was just confused, and it was attacking myself. So that led me to researching that condition day and night. It was my mission and passion to be off of all medication and to be done and rid of this label of autoimmunity that I had. So after hundreds of hours of postgraduate functional medicine and nutritional training, I found my answer. And I actually now am a certified functional medicine practitioner, board certified integrative medicine. I've been that for 8 years. And I use what has helped me to help other people. So I have a unique perspective. I've done it myself. I've done what the doctor said was impossible. I don't take any medication at all. I have no symptoms of autoimmunity at all. And I was told that that would be impossible. I'll be 45 as of this recording in 2 months, and I'm probably healthier than most 45-year-olds that are my age, and I'm probably more active than all those people as well. So even though you may be suffering, and even though you may be told that nothing can help you, it's possible. Don't listen to what other people say in regard to that. It's possible that you can get better. So the philosophy that we use here is one of cause, getting to the cause of the problem, getting to the root of the problem. And there are lots of different causes, and all conditions, despite the label, doesn't matter what the label is, they all have some similarities and some common threads. And those things are infections, like viral infections, parasitic infections, bacterial infections, and these are things that your doctors might not be able to find. You may have had a stool test and been told you don't have any parasitic infection, but a parasite's main objective is not to leave your body. So they might not be found in stool. They can be found in any tissue. So there's infection possibility. There's mold and yeast and candida. There's pesticides and herbicides and things called xenobiotics that act like estrogen in your body and bind to our estrogen receptors. There are things like radiation and antibiotic residues and even medication residues that are in our bodies. So we have to look at everything, and I consider those things to be splinters. And when I talk about splinters and I talk about healing, I like to use the analogy of a wound. Let's say you have a really big wound on your body, and you go from doctor to doctor to doctor to doctor for years, and it's never getting any better. You find this new doctor who has a fancy laser, and that doesn't seem to work for you. You try a new medication and that's not working, a new lotion, a new patch, a new surgery, but nothing is actually getting you better. Then you come to this office and we look for the splinters in that wound and we remove those splinters. And what happens when you remove a splinter from a wound? Does it heal more quickly or does it heal more slowly? And the answer is obvious, it's going to heal. And it's the magic of the body's healing. It's not us, it's just removing the barriers to healing. And when you remove the barrier to healing, your environment changes, your genetics changes. I'm not saying your genes change, but your expression of your genes will change. It's called epigenetics. So when you are in a toxic environment, your body will express the survival genes. If you are in a safe, healthy environment, both at work, at home, and in your body tissues, your body will express healthier genes. So in that way, we can actually turn on the healing, healthy genes, because you may not have been feeling the way you're feeling right now your whole life, and you've always had the same genes. You just probably were expressing them differently. So we also look deeply into interconnected systems. For instance, if you have Hashimoto's or hypothyroidism, we're not just going to look at the thyroid. And we're certainly not going to just look at TSH. We're going to look at a full thyroid panel, as well as all other systems of the body, the liver, the gut, the adrenals, the brain. We'll look at everything together and see where those splinters are in healing a person. So in that way of thinking, I like to talk about pollution of a river. If you live on a polluted river and you need to fish in that river and you need to drink that water, you could go and use fancy technology to remove the toxins from the water system. You could work day in and day out tirelessly to remove those toxins and continue to do that for the rest of your life. Or you could go upstream, remove the factory that's polluting that river, and after you remove that factory that's polluting the river, then remove the pollutants from that water, and you won't have to deal with that again. The same thing happens in our body. If we're having thyroid dysfunction, or we're having insulin, other hormone issues, leptin, insulin, thyroid hormone issues, adrenal hormone issues, we can't just put those hormones in the body without addressing why we're having that problem in the first place. We have to go upstream, and when you go upstream, that's really where the true healing is. That's not where the cover-up is. So that's how we do things here. We're not a supplement-heavy office. In other words, if you're having those hormonal problems, we're not just going to add a bioidentical hormone to that. We're not going to add 14 different supplements to your body. We're going to remove toxin, and as we do that, then you won't need to have all those lotions and potions and vitamins and medications and things like that. So that's our philosophy and that's our approach. Take a look at the website, see what we have to offer. We have newsletters that we send out every month. We have seminars that we do. We have a blog that you can follow. Facebook, Twitter, you can like us and follow us on those, so that way you can get our, what we send out. We also offer a 5-minute free phone consultation for those people who are considering coming into this office and they're not quite sure if what they're dealing with is something that we might be able to help them with. So if you're interested in that, you can call our office and schedule that 5-minute free phone consult. Those consults tend to last more like 15 or 20 minutes, but it's fine as long as it fulfills the mission that we're trying to achieve, which is to help our people that are around us in our communities and beyond to live healthier, happier lives and to be able to reverse whatever chronic health condition that they're dealing with. So again, thank you for coming to visit our website, and I hope it has helped you.